Okay, here are the top 3 questions I get from patients who need to undergo colon resection for colon cancer. Number 1, how long will I need to be in the hospital? Like every answer, it depends. Most of the time, if we're able to do your surgery robotically using small incisions, sometimes people can go home the next day. If you require a larger incision, that usually comes with more pain, and so most people have to stay in the hospital until their pain can be controlled with oral pain medications alone. Previously, we used to wait until people showed evidence of what we call return of bowel function, meaning that they're passing gas or having bowel movements. And now we can let people go home as long as they're able to tolerate liquids and some solid food. Most people are able to go home when that occurs without having to wait for passing gas or having a bowel movement. Question 2, will my diet change after colon surgery? Short answer is no, you will not have to change your diet after we remove a portion of your large intestine. That said, you may have some changes in bowel habits, like they might be a little runnier, you might have a little bit of mucus, you might have some foods that you don't tolerate as well in the immediate post-op period, but in the long term, you will be able to eat the exact same foods that you were eating before surgery. There is no special diet that is needed. Number 3, how will my activities change after surgery? Again, if you have small incisions, once you're recovered from a pain standpoint, you are usually able to resume the exact same activities you were doing before surgery. There may sometimes be some lifting restrictions to lower your risk of getting a hernia in one of your incisions, but those restrictions usually end about 4 to 6 weeks post-op. Now, if you do have an ostomy post-operatively, generally speaking, we don't want you to submerge that like in a pool or in a bathtub for a couple of weeks post-op. But again, in the long term, even people with ostomy bags can go swimming, can go scuba diving, can travel, can do all of the things that you were doing before you had surgery. If you have any other questions regarding colon surgery, recovery, diet, activity, anything like that, drop it in the comments and I will be happy to answer.